The legacy of the Japanese Issei in Hawaii comprises stories of courage, hard work, and devotion to serving the community. These stories and the values the Issei brought with them from Japan inspire present and future generations. Physician and surgeon Dr. Iga Mori was a pioneering Issei who served as a medical, civic, and cultural leader. He was born in Ishikawa, Japan, during the twilight of samurai rule. He later pursued a medical education in the new Meiji era, which was a Western and science-based. He first studied at the Naval Medical School in Tokyo, and then at the Cooper Union Medical College, which later became Stanford University Medical School. Dr. Mori came to Hawaii in 1890 to serve as a medical officer for the thousands of Japanese immigrants working as contract laborers on the plantations. In this capacity, he worked at the Kohala sugar plantation on Hawaii Island. With the outbreak of the Sino-Japanese War in 1894, the Japanese community in Hawaii raised money to send him to China, where he became the chief surgeon for the First Corps of the Japanese Red Cross. He returned to the islands in 1895 and bought a home in the Nu'uanu area at 702 Wiley Street, where he lived with his wife, Yae Nagagawa. Throughout the years, Iga Mori became an active voice in medicine and bridging culture through his community leadership.
The pre-war era was a time where many Japanese American families were beginning to leave the plantation and were beginning to branch out. And so what this meant was that there was a growing move to create churches, establish Japanese cultural, civic, and social foundations and institutions, and to really build out a Japanese American community.
Soon after beginning his private medical practice in Hawaii, he joined other prominent physicians in establishing the Japanese Physicians Association. He was also a founder of the Japanese Benevolent Society and member of the Japanese Medical Association. In 1898, he traveled to Europe to study pathology and bacteriology. This knowledge was quickly put to use upon his return to Hawaii, where an outbreak of the bubonic plague hit the islands. In the midst of a majority Caucasian medical establishment, Dr. Iga Mori supported aggressive public health policy to combat the epidemic. He was among the first physicians to autopsy and diagnose the plague, and he was a vocal proponent of the Board of Health's drive to inoculate residents against further spread of the disease. In the aftermath of the Great Chinatown Fire, a plague remedy that raged out of control, leaving 5,000 immigrants displaced, the Japanese Benevolent Society established the Japanese Charity Hospital to treat epidemic and fire victims. The hospital would later become Kuakini Medical Center.
So Dr. Iga Mori happened to be the first superintendent for the Japanese Charity Hospital, which was established by the Japanese Benevolent Society in July 1900. The Japanese Benevolent Society was founded by a group of community leaders in the Japanese community, and their purpose was to provide relief to contracted plantation laborers who became destitute.
Dr. Iga Mori committed 6 decades of medical service to the Honolulu community. For his many contributions to Honolulu's medical community, in 1914, Dr. Iga Mori was the first Japanese physician granted honorary membership to the Honolulu County Medical Society.
The Mori family was a very prominent Japanese American family. They were extremely well integrated, interwoven into the civic and cultural life of Honolulu. Dr. Iga Mori himself was very instrumental in helping to build up and serve on the boards of a number of very prominent cultural, social, and political institutions.
As an Issei with strong ties to Japan, He advocated for Japanese immigrant issues and sought to promote cultural pride in being Japanese. He served as chairman of the Japanese YMCA Board of Directors and was instrumental in founding the Nu'uanu YMCA. It was the first branch to combine the separate Japanese, Chinese, Korean, and Filipino YMCA associations into a single YMCA building where all were welcome. This was a landmark achievement for racial integration throughout the YMCAs in the United States. Dr. Mori served as a director for the Pan-Pacific Union and then as a board member for the next 20 years.
He was a part of the Pan-Pacific movement, whose mission was first and foremost to try to put forward a Pan-Pacific consciousness or a Pan-Pacific internationalist worldview, in which he really saw narrow nationalisms as kind of disintegrating, and instead what would take shape was a more cooperative international community that was more focused on how each individual nation could contribute to a pacifist world community.
On December 7th, when the Japanese Imperial Navy struck Pearl Harbor, within a few hours, Iga Mori, his son Motokazu, daughter-in-law Ishiko, and teenage grandson Victor were arrested by the FBI. Iga Mori was taken from his Wiley Street home in Nu'uanu to the Sand Island detention camp. The outlines of his detention are chronicled in his diary, part of a series of daily journals that he kept prior to, during, and after the war. Dr. Iga Mori was a pioneering Issei who helped bridge Japanese and American culture through his leadership in the Hawaii medical establishment and Honolulu community. When he passed in 1951, he was eulogized on the front page of the Honolulu Advertiser as Dean of the territory's medical men. Today, the Japanese Charity Hospital exists as Kuakini Medical Center, a symbol of the Issei legacy.
I think the one that many people are aware of is that we're the last surviving hospital established by Japanese immigrants in the United States. I think it's important to look at the history of Kuakini and to not forget where we came from. And also, as we point out to all of our employees, the legacy of our founders is important to be maintained, along with their principles and our core values. And part of that is to make sure that we are servicing the community the best way we can.
The Japanese Cultural Center of Hawaii is proud to preserve and digitize the Mori archival collection to be accessible for individuals, scholars, and the community.
So primary sources like Dr. Iga Mori's diary really allow us to recover the texture and granularity of everyday life for Japanese Americans during this pre-war period. I think the importance of digitizing a lot of these materials, particularly pre-war materials, is this drive for greater accessibility. And what this really means is that it is adding to our understanding of the pre-war period and really being able to understand the individual lives of a lot of these historical actors.
Stories like Dr. Iga Mori's, artifacts, and more relating to the Hawaii Japanese experience can be found in the JCCH Resource Center. For more information, please visit jcch.com.